When the cerebellum is affected, as it often is, we see problems with the coordination of activities in different parts of the body. So we see in the throat and mouth, and also in the eyes, and with gross motor in general, which would be the ataxia. In the ears specifically, we get vertigo, tinnitus, or ringing in the ears, and a problem with decreased hearing. Emotions are affected not only simply by the course of the illness itself, but also by the change in the neurology. So you're seeing some that are perfectly appropriate emotional responses, and you also see some responses that are altered by the disease itself. And this is often described as emotional lability, which just means widely variant from very sad or depressed all the way through euphoric or angry. And this is the blog where I found this graphic of the drama masks. Blurred vision is often a symptom for these folks, as is something known as scanning speech, which is speech that is somewhat robotic. There's not good inflection, and the emotional content is not conveyed in the sound of the speech itself. The mobility of the person struggling with MS is severely affected as the disease progresses, and this is due to several things, including spasticity of muscles. So we can use pharmacological intervention here with medications. We can also see physical therapy being very helpful. Weakness or paralysis obviously also becomes an issue as the disease progresses. So here we see stimulants and also the use of physical therapy. The bladder, the elimination is involved both with bladder and bowel. There's two opposite problems that can occur with the bladder. Small capacity resulting in incontinence, for which we usually use anticholinergic meds, or flaccid on the other side, the flaccid bladder that has no tone, muscle tone, has a large capacity, but then they don't get any signals that they need to urinate, also often resulting in incontinence. And for that we use cholinergic medications. Constipation, obviously with the neuronal involvement of the gut, then you don't get the peristalsis that you should, and so there are dietary recommendations. Obviously also in that is lots of raw vegetables and other sources of fiber. Sexual dysfunction, because of autonomic and muscular involvement, can be significant and part of the disease, and sometimes it's beneficial to bring this up with folks who are nervous about bringing it up themselves. Of course, we don't expect all of ourselves as clinicians to be experts in sexual counseling, but we can certainly remind folks about simple things like using extra lubricants if that's the problem, and then we can also gather information and make a referral if people have questions that are beyond the scope of our knowledge. Neuropathic pain, much as it shows up in other illnesses, shows up in the limbs, and for that, as you would guess, we use antidepressants and anti-seizure meds as adjuvant therapies because the typical pain meds don't help so much.